Sinusitis, also known as a sinus infection, is the inflammation of the sinuses, which are air-filled cavities located in the facial bones. This condition can result from infections, allergies, or other factors that cause blockage and swelling of the sinus lining, leading to the accumulation of mucus and potential infection. Overview: Types of sinusitis. Acute sinusitis. Symptoms last less than 4 weeks and often follow a cold. Subacute sinusitis. Symptoms last between 4 and 12 weeks. Chronic sinusitis. Symptoms persist for more than 12 weeks and can recur multiple times a year. Recurrent acute sinusitis. Several episodes occur within a year, with each episode lasting less than 4 weeks. Causes: Sinusitis can be triggered by various factors, including infections. Viral infections. Common cold viruses are the most frequent cause. Bacterial infections. Bacteria can infect sinuses following a viral infection, leading to acute bacterial sinusitis. Fungal infections. Less common, but can occur in individuals with weakened immune systems. Allergies. Allergic reactions can cause inflammation and congestion in the sinuses. Nasal polyps. These growths in the nasal lining can block sinus drainage. Deviated septum. The structural abnormality in the nasal cavity that can impede normal airflow and drainage. Environmental irritants. Exposure to pollutants, smoke, or strong odors can contribute to sinus inflammation. Symptoms. The symptoms of sinusitis can vary depending on the type and severity, but common symptoms include nasal congestion, difficulty breathing through the nose due to swelling and mucus buildup, facial pain or pressure, pain and tenderness in the cheeks, forehead, or around the eyes, which may worsen when bending forward, thick nasal discharge, mucus that may be yellow or green in color, loss of smell, reduced or complete loss of the sense of smell, hyposmia or anosmia, cough, often worsens at night due to mucus drainage, fever. Mild fever may be present, especially with acute sinusitis. Fatigue, general feeling of tiredness or malaise. Diagnosis of sinusitis typically involves medical history, review of symptoms, duration, and any prior sinus issues or respiratory infections. Physical examination, checking for nasal congestion, drainage, facial tenderness, and other signs of sinus involvement. Nasal endoscopy. In some cases, a thin, flexible tube with a camera endoscope may be used to visualize the inside of the nasal passages and sinuses. Imaging studies. CT scan provides detailed images of the sinuses and can help identify blockages, structural abnormalities, or chronic sinusitis. X-rays. Less commonly used, but can't show fluid levels in the sinuses. Laboratory tests. Rarely, cultures of nasal discharge may be performed to identify specific bacteria or fungi. Treatment for sinusitis depends on the underlying cause and severity of symptoms. Acute viral sinusitis typically resolves on its own. Treatment focuses on symptom relief. Nasal decongestants. Over-the-counter sprays or oral medications can reduce congestion. Saline nasal irrigation. Rinsing the nasal passages with saline solution can help clear mucus and allergens. Pain relievers. Non-steroidal anti-inflammatory drugs and SAIDs like ibuprofen can alleviate pain and reduce inflammation. Acute bacterial sinusitis. If symptoms persist or worsen after several days, antibiotics may be prescribed. Antibiotics. Amoxicillin or amoxicillin clavulanate are common first-line options. Intranasal corticosteroids. These may be prescribed to reduce inflammation. Chronic sinusitis. Treatment may be more complex and can include long-term nasal corticosteroids to reduce inflammation. Saline irrigation. Regular use of saline rinses can be beneficial. Antibiotics. A longer course may be necessary for bacterial infections. Allergy treatment. Allergy testing and treatment may be indicated for those with underlying allergic rhinitis. Surgery. If other treatments fail, surgery such as functional endoscopic sinus surgery, or FES, may be considered to remove blockages or correct structural issues. Complications. While most cases of sinusitis resolve without complications, potential issues can arise, including chronic sinusitis, prolonged symptoms requiring ongoing management, orbital cellulitis, infection of the tissues around the eye, which can occur with severe sinus infections, meningitis. Rarely, infections can spread to the brain's protective membranes. Bone infections. Osteomyelitis of the skull or facial bones may occur in severe cases. Prognosis. The prognosis for sinusitis is generally good, with most people recovering fully with appropriate treatment. Acute sinusitis often resolves on its own, while chronic sinusitis may require long-term management. Prevention. Preventive measures include avoiding respiratory infections. Regular hand washing and avoiding close contact with sick individuals can help. Managing allergies. Effective treatment of allergies can reduce sinus inflammation. Humidifying indoor air. Maintaining adequate humidity levels can prevent dryness and irritation. Nasal hygiene. Regular saline rinses can keep nasal passages clear. Conclusion. Sinusitis is a common condition that can significantly affect quality of life, but with proper diagnosis and treatment, symptoms can often be effectively managed. Awareness of the symptoms and potential complications can lead to timely medical attention, improving outcomes for individuals with sinusitis. If you experience persistent or severe symptoms of sinusitis, consulting a healthcare provider is essential for appropriate care and management.